Hey YouTube family, welcome back to my channel. Yet another video with one of our students in Poland. He's a great friend of mine, and we want to discuss more about because I'm getting queries a lot about Poland medicine. What are the programs there, how it's falling, and what kind of quality education we all are like expecting from this country. So I involved my friend over here. He's gonna give a brief explanation about what kind of things you're gonna find there. And over to you, Maciek. Can you introduce yourself?
Hi, my name is Maciek. It's really good to see you, Chief, because we haven't seen for a long time. And
Exactly.
yeah, I can tell you something about the Poland, about the university, anything you want.
So Maciek, I already know about the college, but I want our you viewers to know. Can you tell about your college, the name of your university, what you're studying in, which program you're enrolled in?
Yeah, I'm studying the medicine. I'm in the fourth year already. Like I passed the fourth year, and in the September, I'm starting my 5th year. And I'm studying in Lublin. It's on the east of the Poland. It's a great university. I'm really happy that I'm studying here. And why I chose Lublin? Because of that, I passed the exam. Luckily, I passed it. It was the entrance exam. They were checking our knowledge from the period, like from the last 2 years, last 3 years from Ukraine. I passed it, and then I started on the same year I was studying in Ukraine. So that was the most important thing for me, not to drop the
It was
another
very
year.
hard to take a transfer from Ukraine and things. That situation was quite harsh at that time, and the entrance exam, the screening test, it was huge, a
Yeah,
drastic change for you, right?
yeah, it was really difficult, and it was like a lot of complication, and it was like something new for not only for me but for all the students from entire world. Like they were studying in Ukraine, but the university really helped us. They didn't make like any laughs, or they were really kind for us. They sent us and any documents we wanted. They are trying to help us. So yeah, they were really nice.
So we already know about this. Let's just move to the present. We whatever happened happened, and now we in a better place, and we have good opportunities and to complete the degree. Another thing I want to ask you, it's going to be quite personal. I want to ask you. I always ask the aspirants, like, what motivated you to choose this field, to be a part of medicine, and even after so much struggle, you're still continuing with it.
Um, First of all, it started in the school when I had to choose like what I would like to do, like who I'd like to become in the future, and I was really into biology and chemistry. First of all, so I started learning a lot of from this two subjects. Then I started thinking about the human body, how the every parts of the body works and maintain their function. And then I started to think like maybe I can help people to cure them and all of that. And uh, that's how it works.
For me as well, it was quite same. My grandfather was a doctor, so he kept putting me in my mind how great it feels to help people and see the smile when you are able to cure them. It's a great feeling. So that also motivated me, and I'm still in that field itself. So second question for you, Maciek, is how the study environment in Poland? Like, it's very strict, and are there a lot of international students over there? And what are the opportunities for these students who want to come there from third countries specifically?
It's a lot of difference for me because I had for the 3 years a lot of studying. I didn't have any practice and classes in the hospital. So, for example, now from Monday to Friday, I spend every day in the hospital. We have clinics. We are going to the specific hospital wards. We are working with doctors and professors. We can examine the patients. We talk with them. We're using the medical tools, so it's now I can really tell that I am studying medicine and that I want to become a doctor even more.
That's great. And how is the patient interaction? And is it specific that we need to know a little Polish or maybe English? English can help us.
For example, of course, there are students from Poland, but sometimes we've got
Mhm.
also the patients from other countries because in Lublin there is also international part for the students, and sometimes their students are the patients. So, for me, it's lucky that I can speak in English and also talk with them. And for the students from the international division, they are going with the doctor who is like their translator, because of course this doctor is from Poland the most often. So they are like asking question to the patient, but the doctor is translating this for the patient.
So that's great. At least they're able to understand. And anyhow, if you're going in a new country, you should learn at least a little bit of language because you're going to spend 6 to 7 years in a place. It's obligatory for you to, at least give a respect for the culture. I'm very
Yeah,
much
of
fond of
course.
learning new languages already.
Yeah, of
I
course,
was in
because
Ukraine at the start, we knew nothing about Ukraine. And
yeah,
later
yeah,
on, we shifted and we started learning.
yeah,
I
that's
was
true,
quite
and
the first one to start speaking.
yeah, that's true, and it's the best for you, because I think it's for myself that if you are in the different country, you need to go somewhere to ask the questions, ask for the permissions for everything. You are going for restaurants, you are going for the shops, you have to talk with the people in their native language. So you should know.
Also, can you put light on this topic? Like, students want to know what is the curriculum in Poland, like in what kind of test like they take every day, or maybe they have a pattern to know if the student is studying or not. What kind of things they make you do?
Mm, it's a lot of different. It's really different from the studying in Lviv, because you are going to the university, and every day you are like had to oral conversation, oral pass the test. Um, like every day you were asking the questions, and you had to get the degree or a mark for it. In Poland, it's not like that, because mostly the doctors ask you questions. They want you to be prepared to better understand the topic we are talking right now for the specific hospital word. But um, the most difficult time in the Poland is when the exam session is coming, because there we have a lot
Mhm.
of exams, and but like for the normal time, like in every month, sometimes we have to pass the specific cleaning. We are getting some questions, but I don't I don't say it's so difficult like in the Lviv, when you are going every day, and every day you are asking the questions, and you had to know the answers.
So over here, it's like you're getting a particular time to prepare yourself for the main exam or something like that. It's not like every
Yeah,
day you're gonna give the test.
yeah, exactly like
That's
that.
that's one of a good option. And what are like if are you able to get in part of any kind of research programs or something like with PhD doctors or research papers, or they're inviting you for big surgeries or something extraordinary?
Like if you are taking part in it, yeah, yeah, of course.
Yeah, exactly.
For example, in the surgery or in the gynecological, we are going for the
Hmm.
surgeries. We sometimes we can assistate with the doctors, but most of the time we are just watching from the short distance, because like in Poland we have the small groups of the maybe 6 students. We are going to the surgeries, we are watching the surgery, the surgeons are explaining the topics, and yeah, of course we can see that, we can sometimes touch the body or the something they are were cutting, or you know.
Exactly. Understand. It's all about getting the practical approach.
Yeah,
They're like I've seen like mostly in Europe in the starting years, you're preparing on dummies and representation of an human body or something. But it's much better if you get an hands on a live body and you're able to perform things over there. So
yeah,
it
and you
can give a
can see it
yeah.
from
Apart from that, what kind of extracurricular you're involved in? Are you able to give it a time for that also? Because I already know you're a good footballer and something, so are you able to play or not?
yeah, I can tell you that there is a lot of free time, because most of the time I finish the classes like in the 1 p.m., sometimes on 12.
Mhm.
So I've got a lot of free time. I can go to the gym, I can go to the football field, I can meet with my
Mhm.
friends. Like, yeah, it's a lot of free time. Some of my friends also are working on the weekends or working after the classes. So yeah, you can connect everything like studies, like extra activities, meeting with friends, and also work if you are organized, of course.
Exactly, yeah. Because many students, specifically from countries like India, Pakistan, Bangladesh, they have sometimes it's an issue for them. They're taking loans and they're coming for education and they are seeking for, part-time jobs or something that can help them study also and just because not every time the parents can fund so much. So I hope it's a good option for them. They can have some part-time option, but I don't recommend myself a lot because medicine in a field where you need to give all your time to medicine first, it should be the first priority. Then even if you're able to complete all this and you still are managing to have a little more of time, and if you're able to find part-time, then it's good to do.
Yeah, and maybe for the example, it's true that in Poland the first 2 years are really difficult because there is a lot of studying, but you have to study to understand the topics you are going to talk about or see in the clinics. They are very important for you. So the first 2 years are really difficult, but for example, on the third year, fourth year, and fifth year, uh, you have really a lot of time. And if you want to earn some money, for example, for your travels, for your future, it's really good idea, and you can easily do it.
These were the basic questions. Now I want to ask one more thing. Like after completing your medicine, have you decided anything yet? What do you want to do? Either you want to do some super specialization, or anything, or you're interested in any particular field
I've got
with respect to
few,
medicine?
I've got few on my mind, but I'm still
Hmm.
checking if I really like to be this kind of doctor, if I can see myself, if I can really treat people and help them. So I'm checking like a lot of options, but I'm really interested in surgeries. It's really like fascinating me, and it's really interesting, but I haven't chosen yet the best one for me.
You will get to know soon. Don't worry about it.
Yeah, I still have some years to check it.
Exactly. Now you can rest and study, but later on it's gonna get more difficult, especially when you will get the residency and
Yeah,
you
yeah,
need to run in colleges,
yeah, yeah,
hospitals.
yeah, yeah. That's true. But I still have some time.
So the last question for me would be like, what do you want to tell the young generation who are opting for medicine and why they should consider Poland for medicine as an option? What they can expect from this country, specifically from medicine? Because I'm not talking about other subjects, but for Poland specifically, from the history speaks itself, it has always been emphasizing on medicine and dentistry. So I know about it, but I want you to give, a light on this topic.
Um, yeah, yeah, I understand. Um, like starting from the bottom, a lot of teachers in my school they didn't believe in me that I can be a doctor. So that was the first thing I wanted to improve, and I wanted to show them that I really can be a doctor. And now I can see, and now I can say that when they see me in my city, they are just looking different from me. Like, is it really true? Is it really happening? So if you really like to do something, you can achieve it, but you need to sacrifice yourself, sometimes some of your activities, because the studies are taking a lot of time and a lot of effort. But I think for me, and I can say already, it is really worth, because like we can say that it's very beautiful subject, and medicine it's just wow. So if you really want to do it, just try and see if you can do it. And for the Poland, I can tell that this country is really kind for the people from other countries, and a lot of students I can see in the bigger city, because not in small cities, but in the bigger cities when there are a lot of universities, there are a lot of international divisions, and I can see that there are even more students, like from the last year, from the last 2 years. They are starting to think maybe I can see myself in the Poland, maybe I can study there. So it's up to you.
So that was like the major questions we discussed because we want what actually, like, I could also say the things, but it's better if someone who's already there and who's experiencing everything can give a better understanding about the topic. And again, if we have some questions from, because I get a lot of queries from students who are actually genuinely want to study medicine and they're opting for good options. And if they ask me questions, we want you to join again and answer those questions. It would be great for us and for them to choose a better career, because right now you're going to be a role model for many students as well, because you're a part of a very good institution. So it's going to be a great opportunity, and I would like you to join again.
Yeah, really, guys. So if you have any question, you can ask Shiv, and he will send me the invitation or send me your questions, and I will try to help you.
Exactly. So thanks a lot for your time, Mr. Maciek. I hope I will call you Dr. Maciek soon.
Maybe a few years.
Yeah, exactly. Exactly. So have a nice time. And that was for our video. So
Yeah,
we know what we're doing. So
thank you very
take
much.
care, Maciek.
It was
Thanks
nice.
a lot for your time.
Yeah, it was nice to see you.